Back pain. It's one of the most common reasons people miss work or visit the doctor. But what do you do if that backache just won't go away? Dr. Wieser of Baylor Orthopedic and Spine Hospital at Arlington is here to help. He's also the founder and medical director of the Spine Center at Arlington Orthopedic Associates. Great to see you.
Great, thank you.
It's a common problem. What are some of the main causes of back pain?
Well, you're exactly right. Back pain is extremely common. The spinal literature suggests that 95% of Americans will experience back pain at one point in their life. And so it's very common. There are a lot of common causes of it, and most common cause is probably just a simple lumbar strain, and that's where you go out in the yard and you're lifting something heavy. The next day you wake up and it might be 2 or 3 days in bed because of the pain. So oftentimes it's just a mechanical problem like the muscles. Other times it's actually a structural problem, and structural problems such as disc herniations, bone spurs or osteophytes that cause pressure on nerves can cause significant back pain. Additionally, even things such as spinal instability like a spondylolisthesis where the bone actually shifts forward and creates instability within the spine.
That sounds painful.
It certainly
brings me
does.
to my next question, though, because it could be a sudden injury, like you were saying, you're out in the yard doing some yard work and poof, you have a back injury. Or it could be something that's been going on for a long time. But my question is, at what point do you know to go see a specialist?
Generally, when a patient has pain that lasts more than 2 or 3 weeks, it's substantial. It's really affecting their quality of life. Those are patients that additionally have pain that radiates into the legs or into the arms if it's neurologic. So if they have pain or numbness or even weakness in their muscles, it certainly can. Those are things that, if it wakes you up at night, if it have abdominal pain associated with it, there are different causes of the pain, but certainly if there are neurologic causes, including the symptoms radiating, like people call sciatica, those are reasons to go to the doctor.
Here's something that I think a lot of our viewers may not know, and it's really interesting. Baylor Orthopedic and Spine Hospital at Arlington, one of the few specialty hospitals right here in North Texas devoted to the surgical care of orthopedic and spine patients. So what exactly are we talking about in terms of services that it provides? Baylor
Orthopedic and Spine Hospital at Arlington is a single specialty hospital, which is really the only orthopedic specialty hospital in North Texas. So all that we do there is orthopedics, which includes general orthopedics, hand surgery, foot and ankle surgery, total joint replacements, and especially spine care, which is what I do.
Okay, if someone's out there, they're suffering with back pain, they've tried the medications, maybe injections, physical therapy, it's just not working anymore, and surgery seems to be their only option. Should they be concerned, and what are their options?
Well, the nice thing is technology has gone to spine care as well. And in spinal surgery, I did a fellowship at the UCLA Spine Center and really focused on the most minimally invasive ways of treating patients surgically. So we do very conservative care at Arlington Orthopedic Associates when we see patients. But when it comes time to have surgery, we try to employ the most minimally invasive ways possible to take care of their pain, to get them back to work sooner with the least amount of pain, and ultimately have good patient outcomes.
That's great. And I want to brag on you for a second, because your hospital has received national recognition. That's huge. Tell us what makes it stand out.
Well, I think at Baylor Orthopedic and Spine Hospital that the fact that it is single specialty really makes it stand out. When you do the same thing every day, all of our nurses, our administrators, our nursing assistants and physical therapists, including the physicians, I mean, when all you do is orthopedics and spine care, you get good at it. And it's really shown that. The Press Ganey has shown us to be the top 95th percentile the last 4 years running.
Well, congratulations. Thanks so much.
Well.
We appreciate it. All right, you can find out so much more about Baylor Orthopedic and Spine Hospital at Arlington by calling the number on your screen, 855-4ORTHO, or go to BaylorArlington.com. GMT will be back right after this.